A 32-year-old woman who is now in her 14th week of pregnancy has previously accepted prenatal screening. You receive a call from the prenatal screening lab notifying you that the testing shows she carries a CF mutation, the common Delta F508 mutation. The lab advises you to contact the woman and obtain a sample from her partner. As you are quite aware, women who undergo screening expect, given the odds, to have a reassuring screen-negative result. Thus, you realize your call will be seen as bad news, even though it has no medical implications for the woman herself and only slightly increases the risk that her developing baby is affected. This is because both she and her partner must carry a CF mutation in order to put the developing baby at a high 1 in 4 risk of having cystic fibrosis. As a first step in preparing for the call, you review the information that was provided to her and to all of your patients at the time when a screening sample is obtained. This is in the video segment that follows.
Hello, I'm Jerry Erickson, a genetic counselor with the Prenatal Cystic Fibrosis Screening Program at the Foundation for Blood Research. I'd like to take a few minutes to tell you about the Prenatal Cystic Fibrosis Screening Test. Cystic fibrosis, or CF, is an inherited condition. People with CF have 2 mutations, or non-working copies, of the CF gene. This results in the production of thick mucus that clogs the lungs and leads to infections and lung damage, making it hard to breathe. Thick mucus can also collect in the pancreas, causing problems with digestion and growth. CF does not affect intelligence. People who have CF are not always affected in the same way. Most become sick as children, and others don't get sick until later in life. Some don't get as sick as others. There is no cure for CF, but treatment is available that improves the length and quality of life for people with CF. Most babies with CF are born to couples who are not aware of CF in either family. To have CF, a baby must inherit 2 non-working genes, one from each parent. If only one parent has a non-working CF gene, the baby cannot have CF. If someone in your family or your partner's family has or had CF or carries a CF mutation, the chance for your baby to have CF is higher than average. If you have a family history of CF or know someone in your family or your partner's family carries a CF gene, please tell your healthcare provider. The result of the test is reported as either screen negative or screen positive. A screen negative result means that, as a couple, you do not have a 1 in 4 chance to have a baby with CF. However, there is still a very small chance that your baby will have CF, since screening for CF cannot detect all CF mutations. A screen positive result means that we found that both you and your partner have a CF mutation. This means that there is a 1 in 4 chance that your baby also has these 2 non-working CF genes. Other prenatal testing will be needed to tell for sure whether your baby has CF. You will have a chance to discuss the results and your testing options with your prenatal care provider. This screening test will find nearly 80% of couples who are at 1 in 4 risk for having a baby with CF. The detection rate is not as high in Native American, Hispanic, African American, or Southeast Asian couples. This is because CF is less common in these groups. I hope this information has been helpful to you in understanding prenatal screening for CF. All of us at the Prenatal Screening Program at FBR wish you a happy and healthy pregnancy and baby.
After reviewing the video, you have an idea of what she was told about the screening process, although it is very possible she did not absorb all the information and might need some clarification. As you think about what you will say when you call her and request her partner's sample, check your understanding of the CF screening process by answering our questions.
After listening to each question, pause the video and select your answer. Then listen to see if you are correct. A negative CF screening test completely rules out CF in the developing baby. True or false? The correct answer is false. The CF screening test detects what percent of couples at a high 1 in 4 risk of having a baby with CF. 80%, 25%, 1%, 100%. The correct answer is A. The video emphasizes that prenatal CF screening is designed to identify at-risk pregnancies, and at this point in screening, only the patient's sample has been evaluated. Your patient had blood drawn at the time of general prenatal screening, and her sample was also sent for CF screening. What is the likelihood that her partner's blood sample will also be positive, carrier detected, if he is a Caucasian? 1 in 30, 1 in 4, 1 in 100, 1 in 625. The correct answer is A. Which two organs are most affected in CF because of thickened secretions? Brain and kidney, kidney and skin, liver and lung and pancreas. The correct answer is D.